Okay, guys, moving on to the elbow. Remember, we're looking at both muscular and bony landmarks as well. Okay, so the elbow joint made up of three separate components: the ulnar to the radius, the humerus. So we're looking at the right forearm and arm anteriorly, so in an anatomical position. And this is the upper arm, humerus. This is the forearm made up of the radius and the ulnar. So there's three joints here, isn't there? The humerus connecting into the radius, so humeroradial joint. The humerus connecting into the ulnar, humero-ulnar joint, and the radius connecting to the ulnar, the radio-ulnar joint. So there's three joints here. Now, if we're looking purely at the humero-ulnar joint, then this is a synovial joint, and we've talked about a synovial joint and what that actually is. You need to remember the components that constitute the synovial joint. And it's between the humerus, the trochlea of the humerus, and the trochlea notch of the ulna. And that joint alone will only allow flexion and extension of the elbow joint. If we look then at the humeroradial joint, that is looking at it's a hinge joint between the capitulum of the humerus, and the radial head. So this is a radial head in here, and that too will only allow flexion and extension between these two. However, the relationship between the radius and the ulna creates a different environment. So the radio-ulnar joint, there are two. So the radius and the ulnar join proximally at the elbow and distally at the wrist. And the combination of those allow the radius to rotate the head here. So this is in an anatomical position, so the forearm will be supinated. It allows the radius to rotate and move across the ulna, and that is known as pronation. So we're talking about supination to pronation. So that's in a supinated position, so the back of my hand is to you, and if you turn the wrist over so my palm is facing towards you, that is pronation. And so this joint here, both proximal and distal, allow that pronation to occur. Pronation, well, and both pronation and supination, we can move it back and forth like so. But the actual biomechanics of the activity at this joint, both proximally, distally, is rotation. So this rotates in relationship to, so the radius rotates in relationship to the ulna. All right, so let's look at a few muscles. Brachialis is from the distal aspect of the humerus, so distal 2/3 of the humerus, into the coronoid process of the ulna. So this is the ulna and this is the radius, yeah? And so we're looking at the right arm and right forearm anteriorly. And what this allows to do is, because it crosses this joint, it will flex both the humeroradial and the humero-ulnar joint. It'll flex that joint. Brachioradialis, so we're looking at the distal aspect of the humerus, specifically the proximal 2/3 of the supracondylar ridge, which is in here. Again, you don't need to remember origin and insertion, but we're talking about bony landmarks inside the distal aspect of the humerus, into the lateral aspect of the distal radius, right? Lateral aspect of the distal radius. Now, that means that we are looking at, this is the forearm, the left arm and forearm posteriorly, right? These are the extensor group in here. So I'll say it again. This is the humerus posteriorly, and this is the ulna and the radius posteriorly. And so brachioradialis, going from the distal aspect or the lateral aspect right, of the humerus into the lateral aspect of the radius. And of course, because it crosses the elbow joint, then it's going to flex the elbow joint, humeroradial and humeroulnar joint, and it will also pronate the, so humeroulnar and humororadial joint flexion in mid-pronation. All right, now, essentially what it's saying is it flexes the forearm against the arm, so the forearm against the arm, when the forearm is in a pronated position, when the forearm is in a pronated position. All right, pronator teres, so we're going to be looking at this will be the anterior humerus, anterior radius, anterior ulnar, all right? So anterior radius, anterior ulnar, and anterior humerus. So we're looking at the right arm and right forearm anteriorly. So these are going to be the forearm flexors in here. Pronator teres from the medial epicondyle of the humerus into the lateral surface of the radius below the oblique line. So it's mid-shaft, probably proximal third, but mid-shaft of the radius. And of course, if that contracts, it's going to turn the forearm over. It's going to pronate the forearm. So proximal radial-ulnar joint pronation. Supinator is, as it sounds, it will supinate. So that's that action there. It's going to turn it over in that direction. Now, this is the radius here, and you can tell that's the radial head. So that's going to be the ulnar here. As a result, then, we are looking at the right forearm in a pronated position. So this is the posterior aspect of the forearm. I'll say it again. We're looking at the right forearm in a pronated position. This is radius here. This is ulnar here. And so the forearm is pronated. The supinator is from the lateral epicondyle of the humerus, lateral epicondyle of the humerus, lateral epicondyle of the humerus, into the supinator crest of the ulnar, the supinator crest of the ulnar. Sorry, that's origin here, lateral epicondyle of humerus, and into the supinator crest of the ulnar. And that then goes into the proximal third of the radius, proximal third of the radius. And I'm sure you can see what happens here. So this is a forearm in a pronated position, the forearm in a pronated position. If this contracts, it will pull this over, and so we end up with supination that's occurring. So humeroulnar and humororadial joint flexion, it crosses a joint, so it'll flex the joint, and it will also supinate the forearm as well. Okay, pronator quadratus. So we're going to be looking at the ulnar. So we're looking at the anterior aspect of the right forearm, ulnar radius. Pronator quadratus goes from the distal aspect of the ulnar to the distal aspect of the radius. And of course, I'm sure you can see what it will do. It will pronate at the proximal radioulnar joint, all right? So superiorly, but it'll essentially pronate the forearm at that proximal joint. Okay, I need to mention the cubital fossa. Now, the cubital fossa, we'll look at, this is the lateral aspect of the left forearm, the medial aspect of the left forearm. If we were to draw a line across the epicondyles, the distal aspect, so epicondyles of the humerus, and we use pronator teres as the medial border and brachioradialis as the lateral border, so left forearm, lateral aspect, medial aspect. Then contained within that triangle, and it's often referred to as the cubital triangle, is a fossa, a depression. And within that sit the median nerve, the brachial artery and vein, brachial artery, and deep to that is the vein. The tendon of biceps brachii, and the radial nerve, right? The radial nerve as well. Those components go through this fossa, this space beneath this tendon, yeah? And as a result then, from a clinical perspective, it's of significance because, for example, tightness with brachioradialis or pronator teres can create compression on median nerve or brachial artery and vein or radial nerve, and that then can create clinical symptoms like tingling and numbness in the hand. In this case, we'd be looking at the left hand as well. All right, and the last one here, we are looking at the cubital tunnel. Now, this is a medial view of the right elbow. I'm going to say it again, a medial view of the right elbow. So this is the humerus, this is the ulna, and the radius is going to be deep here. Now, there's a ligament that crosses between the humerus and the ulna, and that ligament, along with the medial border, is the medial epicondyle of the humerus, the olecranon process on the ulna, and there is a fascia, a ligament that crosses between the two. Underneath that runs the ulnar nerve through what is known as the cubital tunnel. Now that ulnar nerve can again become compressed and as a result create symptoms like pain, numbness and tingling down into the hand as well. So the cubital tunnel has clinical significance as well. Okay, I'm going to leave it there.